A lot of times, patients contact us doctor wanting us to prescribe for them online over the phone or through text messages. This is not usually a good practice. It is not the best for the patient, for the doctor and their loved ones. And the reason is this: because important diagnosis will be missed, which may lead to disastrous consequences if consultation is purely done on the phone, online, over the social media. Now, there are standard way by which doctors arrive at diagnosis when you present with a complaint. These standards way will not be achieved if consultation is purely done on the phone or over the social media, and it can cause a lot of undesired consequences. But a lot of time, few doctors who refuse to consult over the phone through text message has not been nice. And I'm going to explain why. When you go to the hospital to see your doctor, there are procedures and ways we follow to arrive at a very correct diagnosis. The doctor will first interact with you by asking questions about your complaints and all other factors associated with it. This is what we regard to as history taking. It's a very important aspect of your presentation. Over the phone, most patients don't know what is important to complain about, what is important to talk about, and the history taking might not be as it's supposed to be. Secondly, when the doctor has taken appropriate history from you, he will go ahead to examine you from head to toe, to examine the parts of your body that's importantly affected by your complaint. This is impossible through text message, over the phone, or it will not be ideally done. And then the doctor will now conclude by asking you to do essential investigations. All these processes together will help the doctor to arrive at a right diagnosis and provide appropriate treatment for you. But a lot of time we like shortcuts because patients don't want to pay or they are too busy. But in the long run, it may be like being penny wise and pound foolish. So the right thing to do when you have a complaint is to physically see the doctor, who will assess you appropriately and arrive at a diagnosis. This will help you to achieve a good health care. An example I would like to cite is one of my patients after being discharged from the hospital after a successful surgical operation. She contacted me complaining of chest pain. She attributed that to ulcer. But thank God I insisted on her coming back to the hospital. She had started ulcer medication, but when she came to the hospital and we examined her, we decided that she had clots in one of her lungs. And this is a very common cause of sudden death. We had to rush her with ambulance to a tertiary hospital for proper care. If I had gone ahead to treat her purely on the phone, it could have resulted in her death. And today she's still alive, bouncing and kicking. So I want to advise that we should not always seek a shortcut. Let's go to see our doctor physically, who will do the right thing to achieve the right diagnosis. But after you have seen the doctor, in setting where it is allowed, your follow-up may be done over the phone, over the social media.